Chapter 3, Part 2. We left off on indemnification compensation for financial loss suffered by Employees Act. So legal cases related to clinical laboratory, so patient falling. So we have an obligation to make sure patient's in a secure chair so they won't fall. Hematoma or hemorrhage, and we're talking about a really bad bruise. So we were probing around the arm and then we failed to hold significant pressure to allow the site to appropriately clot. Abscess or other infections. We go to use our equipment, it falls on the floor. We pick up that equipment and try to use it on a patient. Injuries from fainting. We have a patient that comes in, for example, states they have a history of fainting. We then have them lay down, but we don't keep them for 15 minutes after the procedure and allow them to leave, and they have a fall in the elevator outside of our facility. Nerve damage. Again, we talked about this with the basilic vein. Complications from collecting blood from the mastectomy side. Please be aware that it doesn't matter the length of time. We can never draw blood from the side of a mastectomy. It could be 10 years, it could be 50 years. We don't know enough about the patient history, so we're told not to draw. Even doing a finger stick or a hand draw is not advisable. Complications in blood collection from obese patients. If we excessively probe around in the arm, we can not only cause damage, but we can also cause false test results. Wristband or identification error is huge. So for example, if your patient states their birthday is 3/3/86, but their band says 3/6/86, we need to follow up on that identification and make sure that it is correct prior to drawing the patient. This is not something that can be done after the draw is performed. Examples of past phlebotomy lawsuits. Venipuncture performed without proper training. So this is done by having a technician who wasn't properly trained, ultimately went into the basilic vein and actually severed the artery. Failure to take precautions to avoid patient syncope. So instead of having the patient lay down because they have a history of fainting, we have them sit up in a traditional draw chair. Patient death caused by misread glucometer results. So this would be an example why it's so important to do quality control. The patient, if the quality control were to be off and we continue doing patient testing, we could then end up misdiagnosing our patient. Improper blood collection resulting in nerve damage to the patient. We talked about this before. The other thing with the glucometer results is understanding what our low and high values are. So generally reports under 50 are considered low. Anything generally over 120 is considered high and needs to be followed up by a physician. HIV-related issues. The healthcare worker must demonstrate a causal connection between his or her HIV infection and his or her employment. This includes having documented incident report at a healthcare facility involving a nail stick injury and puncture wound or other exposure to the HIV-contaminated blood or bodily fluids. The healthcare worker's lifestyle will be investigated to determine whether the exposure occurred elsewhere. In pre-employment health evaluations are used. Employers are legally responsible for monitoring post-exposure follow-up as well. Most industries provide professional liability insurance. Often the healthcare staff in the hospital or clinical laboratory is part of the professional liability insurance policy. Increased legal exposure for allied health and nursing professionals. Examine need for personal professional liability insurance. Does the employer carry liability insurance? Is it adequate dollar value coverage provided? And this is stuff you can ask post receiving a job in the industry. Procedures that must be followed for policy coverage. Lawyer's best interest at heart is a job change expected soon, and specimen collection provided off-site. So if you were to draw patients in their home or nursing homes, are you covered? CLIA, the Clinical Laboratory Improvement Amendments. CLIA regulates and ensures the quality and assurance of laboratory testing. Essentially applies to every clinical laboratory testing facility in the United States and requires laboratory certification by the federal government. This is used for moderate complexity or high complexity testing. The inspection considers all procedural steps in laboratory, so our pre-analytical, analytical, and post-analytical. So an example of a moderate or high complexity would be those in the lab that actually run blood cultures, for example, or run chemistry tests. This requires advanced degrees. It also requires advanced certificates in order to be compliant. Where wave tests are the easiest to perform, least susceptible to error, and least risky to the patient, so urinalysis, blood glucose screening, are not required to undergo an inspection. Sometimes even our point of care testing for coagulation studies. These are what's called wave testing, and they're the easiest to perform, so they are not as highly regulated as our moderate complexity. Some states, California, New York, and Florida have license regulations or testing requirements that vary according to technical responsibility for laboratory personnel. Phlebotomists are allowed to perform point-of-care tests in some states, and in others they are not. So it just depends upon the state and also on the healthcare facility. Okay, so that concludes Chapter 3, Part 2. I'm going to have a PowerPoint presentation concluding after this to cover some ethics, bioethics, so you understand some case studies that might pose as examples. Chapter 3, this would be our in-class activity where we investigate and look at ethics and bioethics a little bit more thoroughly, so I'm going to present it here for you to view. So case study 1, Sally and Bob work at an outpatient lab at Kingdom Hospital. Sally is faced with the professional choice and seeks Bob's assistance. Sally is to draw blood on a 9-year-old child, and when choosing her cleaning agent creates an allergy in the patient. Is this scenario an example of ethics or bioethics? I want you to reference back to your Chapter 3 textbook on this. We'll come back to this to explain what this is, but I want you to kind of take a look at this. Take a look at the definitions for ethics and bioethics, and then make a choice on this case study. Case study 2, Bob and Sally work at an outpatient lab at Kingdom Hospital. Their patient Sally Bones needed to utilize IVF to become pregnant. The patient's eggs were then tested to eliminate the genetic markers for Huntington's disease. Should the patient be allowed to also decide what gender her child will be? Is this scenario an example of ethics or bioethics? So this is something we really have to look into because we're starting to play with information that would normally not be available. The other thing to take into consideration as you're choosing what example of this is that this procedure is sometimes costs $20,000 or more and is not covered by insurance. Case study 3. Bob and Sally work in an outpatient lab at Kingdom Hospital. Their patient Sam Bones was diagnosed with HIV and told the medical staff that he does not want his wife knowing about his recent diagnosis. You go into the room to draw blood and the wife asks you what you're testing his blood for. Can you tell the wife this information? Is this scenario a violation of the patient's Bill of Rights, HIPAA, invasion of privacy, or patient confidentiality? We're going to go back to case study 1. This case study would be an example of ethics. We would do no harm to our patients, and we choose cleaning agents that would be appropriate. In this scenario, it could fall into ethics and bioethics because it depends upon our 9-year-old child. Did we know this patient had an allergy to this reagent or cleaning device? Did we ask if they had any allergies that we needed to be aware of? So this could play into both ethics and bioethics, but I will have a discussion up on Blackboard where I would just like your response to case studies 1 through 3, just giving your example of what you think this might fall into. Is this ethics or bioethics? Case study 2, should the patient also be allowed to decide gender? In this case, it falls into, again, more of bioethics because this is using technology to allow a patient to become pregnant. it does fall into ethics too, because people think that this should not happen. If you weren't given the ability to have children without this, then it shouldn't be messed with. The other thing that you got to look at when we start messing with genetics is what other outcomes could we have. This could eliminate a disease that could potentially be life-altering, obviously. So a lot of people would agree that, yes, if this is what you need to determine. However, there's a lot of people that think it's unfair that the healthcare industry makes it so costly that not everyone can afford it. So I want you to decide what you think. Is this ethics or bioethics? I gave you kind of my example of this. This is a factual case study, and the patient, in fact, did choose the gender of both their children and also eliminated eggs because the patient themselves had Huntington's disease and knows the progressive loss of muscle. Also to it, eventually the ability for muscle movement impacts the patient's ability to breathe and various other things. Case study 3. We are not obligated to tell a patient's family about a test we are drawing for unless the patient gave consent. We cannot even tell the patient's wife this information. This is actually, I want you to really think about, does this violate any of these? As a technician, we're only allowed to disclose the bare minimum because we don't know enough. It does play on our ethics a little bit. Is it right? Does it foster a win-win? We think that the wife should know about this. However, we also got to be mindful of protecting our patient. So I want you to think about, is this scenario a violation of the patient's Bill of Rights, HIPAA, invasion of privacy, or patient confidentiality? And then give kind of your rationale as to why you think that is. Because it's really important that we understand what the difference between ethics and bioethics is, and also realizing that in the medical field, there is a lot of gray area. Another example of this is if we have a pregnant patient, let's say, that got hurt, is in a coma, but is, 25 weeks pregnant, do we keep the patient on life support and continue the pregnancy? And that, again, goes into ethics and bioethics. And this is why the medical field is not easy right or wrong. It has to be this answer or that answer. It's really, really difficult. There's a lot of gray areas. And this is why I bring up these case studies to give examples to Chapter 3. Because I think it's really important to understand as providers, not necessarily us as phlebotomists, but physicians have a really hard time making these decisions that ultimately sometimes goes against what the family's wishes are. Because of, is it going to impact the well-being of their patient? Is it going to allow them to recover? So just kind of something to keep in mind. And I included a little image here. Wake him up. We need informed consent for the next part. Informed consent prior to surgery is that you're consenting to the procedure and that you know the risks involved and they went over what they're going to perform, and then the outcome as well as the recovery. So I want you to view these. I will have a brief discussion posted in Chapter 3 and just give, do you think it's ethics, bioethics, and why? This is a safe classroom. I want everyone to be aware. So when you post stuff online, please be aware that we want to be considerate of everyone's opinions and that we are doing an informed piece. So we can't allow our emotions to get heightened because of this, and everyone's going to have a different view, so please be respectful of others as you're posting comments to this. And that will conclude our Chapter 3 class activity as well as the Chapter 3 PowerPoint for this lesson.